are recognized. I'd also like to welcome our secretary, Secretary Ted, was a former member of the board of Red Cross. Yeah, fellow Red Cross. Yeah. Please proceed.
Thank you. Thank you, Mr. President. Mr. President, the total new appropriations of the Department of Health, this is the sum of the Office of the Secretary, attached agencies, and corporations under the committee report, is 353,269,108,000 pesos. The breakdown is as follows. For DOH Office of the Secretary, the total new appropriation is 242,488,933,000 pesos. For National Nutrition Council, total new appropriation of 824,210,000 pesos. For the Philippine National AIDS Council, total new appropriation of 43,916,000 pesos. For the Lung Center of the Philippines, total new appropriation of 1,191,107,000 pesos. For the National Kidney and Transplant Institute, with a total new appropriation of 1,946,054,000 pesos. For the Philippine Children's Medical Center, total new appropriation of 2,355,587,000 pesos. Philippine Heart Center, total new appropriation of 2,730,814,000 pesos. Philippine Institute for Traditional and Alternative Healthcare, total new appropriation of 173,854,000 pesos. And the Philippine Health Insurance Corporation with total new appropriations of 101,514,633,000 pesos. Mr. President, I'd just like to point out that the Senate has made significant increases to the budget. Our chairman, Senator Angara, has, as always, accepted many of the amendments this subcommittee has recommended. With that, Your Honor, we are ready to accept questions from our colleagues. To start with, the Minority Floor Leader, Senator Pimentel.
Thank you, Mr. President. PhilHealth is receiving quite a big amount, Mr. President.
Is that a question or
Yes,
a statement?
It's a statement which I want I was hoping the sponsor would complete, Mr. President. So yes, PhilHealth is receiving a subsidy to the tune of 101.5 billion pesos for next year, Mr. President. So if I could start with PhilHealth, Mr. President.
Of course, Mr. President, we can.
There was an alleged massive data breach that leaked the confidential information of PhilHealth members and employees. Did this really happen, Mr. President, and can we get the explanation?
Yes, Mr. President, that is a fact. It really happened. And we include that during our hearing? Or we had a special hearing?
We had a special hearing regarding
not the data breach. Okay, okay. Mr. President, in a nutshell, no, this happened in September 22 of this year. The ransom group known as Medusa demanded $300,000 and if not paid, threatened to release the entire of the stolen data online. This data consisted of confidential information. The following day, on the 23rd of September, PhilHealth sent out an official statement, update on temporary systems downtime to inform the public that all systems such as the website and others, other portals were disabled and unplugged for security containment. And then on 11 October, the Senate, through our office, held a hearing and PhilHealth officials stated that they have restored their systems. On the 18th of October, SVP Santiago stated that at least 13 million PhilHealth members and their information has been affected by the cyber attack, and 600 to 800 employees' data have been leaked. The National Privacy Commission stated that at least 700 gigabytes of data was stolen and contained sensitive personal data. A total of 72 workstations were affected by the cyber attack. As of November 14, today, web-based systems, e-claims, members portal, etc. are restored. The core system are also restored. Not yet completely restored are the utility system like risk information system and other internal systems.
So, thank you for that, Mr. President. We are glad to hear that the operations of PhilHealth were not affected by the breach in their computer system and the hacking, no, the hacking. But my question, actually, Mr. President, is since this has happened, can PhilHealth assure us that they will take measures, and what will these measures be so as to prevent a similar incident in the future?
Mr. President, the PhilHealth definitely has been working on beefing up its security system. That is the short answer. If His Honor would require
Yes,
a more detailed answer, I can also ask for
Sige.
it or submit
No more, no.
something.
Yes,
Is that
yes,
okay?
in writing, Mr. President.
Okay.
I think the cyber attacker made good on its threat. It released the data yata, online in the internet. That is what happened.
Hindi, nandiyan yun. Pero na-release ba yun? Pero ang tanong niya is, nag-release ng data. It has been affected. The data was attack, na-leak. Yes. That is accurate, Your Honor. There was data that was in fact leaked. Ano yan? Basta lang muna siya. Actually, Mr. President, just to add to the details, a crisis committee was created and a consultant on security was hired, and there is also a business continuity plan that was put into place.
Yes. May we know the name of the new head of the PhilHealth, Mr. President?
Complete name.
Who heads the PhilHealth now?
Yes. The president is Mr. Emmanuel Ledesma Jr.
Emmanuel, Mr. Lindell. That's why I'm asking this, Mr. President, kasi malaki yung 101 billion pesos yung ating subsidy sa kanila. And I'm sure a part of that amount goes to ICT projects. Hindi naman siguro to lahat for reimbursements or for benefits of my ICT. And I believe this is not the only year that we are funding an ICT project in PhilHealth. I think we have funded that for how many years? And yet this data hack happened, Mr. President.
Never natuloy yun, di ba? Tama ako, di ba? Alam ko never natuloy yun. There was an agreement.
Ano ba yung 101 billion niya? Puro benefits ba yun?
If I remember correctly. Tama ba? Yung malaking funding ng ICT never natuloy yan. So hindi. The answer is no. So magkano rin yung mali? Magkano lang? Malaki ba? Sige. Ano, pero in the past. Ano yung past? Yeah, the 7.5. But previous to that? Previous. Ang tinatanong niya previous, sabi niya taon-taon. Nagpa-budget tayo. Sabi niya taon-taon. Ha? Oo nga. Well, to begin with, Your Honor, PhilHealth for the past few years has been requesting for increase in their administrative budget, which would cover itong mga ICT upgrades that they need. And it was granted only this year. Tama, no? For this 2023. Tama ba? 2023. In the past, I recall, that's why I was just asking my team to verify, lagi naman pong may request, but never in the kind of amount that they wanted to really do a really good upgrading of their system, Your Honor, Mr. President.
Yes, but this 101 billion is a subsidy, so meaning to say they have corporate funds. So did they neglect to did they neglect to set aside amounts for their computerized system, Mr. President, to prevent this kind of a hacking?
Ano ba?
Puro benefits yun.
No neglect, Mr. President, Your Honor, according to PhilHealth.
Sige, let's just learn from this incident because dito yung, sa pagkakaalam ko, yung hackers po ay talagang linagay nila sa online, sa internet, yung data na nakuha nila sa PhilHealth systems. I think that's a statement of fact, Mr. President. COA reported that there are hospital claims amounting to 590 million pesos which were denied for reimbursement by PhilHealth. Okay. This is in addition to the regular complaint or the periodic complaint that it takes too long for the hospitals to be reimbursed by PhilHealth. Ibang issue po yun. Ito po ay denial of claim. So, this means that hospitals are claiming to have incurred this expenditure but PhilHealth will not reimburse them. So, loss po nila ito. They will have to absorb these amounts which they have spent. So, may we know what are the reasons used by PhilHealth in denying the claims of hospitals? Ano ba yun?
Mr. President, there are a number of reasons why hospital claims are returned to the hospitals by PhilHealth. Just to very quickly go over them: unavailability, incomplete, inconsistent documentation, discrepancies, forms, signatures are not available on the document, errors encountered for referral to services, unposted, dependent in membership database, and there's more reasons, Your Honor. But this representation had asked earlier when the basis are the lack of documents and the lack of signature, which is kind of sad. I mean, I can understand lack of documents, but lack of signature. So, upon further inquiry, these denied claims, they can still file an appeal with these denied claims. If I may just add, no, I'll address it directly to PhilHealth. Siguro naman yung lack of signature, ano lang naman yun, isang text nyo lang dun sa ospital, pwede naman ma-remedy yun, ano? Tama ba ako? Ginagawa nyo yan. So, pag nasama yung 590 na to, malaki naman yung chance na by the time na binigay ng COA ito, yung mga lack of signature na issue na resolve na yan. Oo naman daw po, Mr.
Whose signature
President.
are we looking for? Is it the patient or the one hospital
whose signature
official
is missing
officer?
here? Officer. Yeah, so it's any of the following: the patient, the doctor, or the hospital authorized officer.
Then ako po yung nalulungkot lang dahil sana klaro. I mean kasi
De, ito naman po, sir,
590 million, malaki po itong halaga.
Malaki
Maybe
po, yes.
Pwedeng bumagsak ang isang hospital rito, even a portion of this amount, Mr. President. So, I mean, hindi pa ba ganun kaklaro up to this up to this time, Mr. President? Ano yung requirements ng PhilHealth? How come hospitals used to dealing with PhilHealth will still make such a basic oversight or deficiency, Mr. President?
Well, they're coordinating closely with the hospitals to avoid this. They are also concerned kung bakit, reasons like this are happening. Pero nangyayari nga po talaga. From my recollection sa hearings po, when I also ask about this, ang dami lang kasi talagang fina-file na claims, no, in one day, right? What was that? You gave me a number before, eh. How many claims are filed in a day?
Approximately 22,000 number of claims.
Yeah. you receive, no? 22,000? They receive 1 million claims per month. So I would suppose a hospital also churns out how many in a week or in a month. Kaya, ito, PhilHealth receives 10 billion worth of claims every month. And for the information of the body, Mr. President, because this was brought up during the hearing, the 27 billion unpaid claims in August has already been paid. So this is, what's this? 95%, sorry, 95% of the 27 billion has been paid. Because it was brought up in the hearing, so for
Yes,
his honor's information.
Thank you. So,
Okay.
but yung denied claims, there is no allegation that these are spurious claims, fake claims.
Hindi naman. No.
So talagang ano lang, there are formal defects or deficiencies. No?
Yeah.
I mean, medyo malaking halaga. Sayang, I mean, a little more.
Pero mababalikan po yun,
briefing.
Mr. President, no? So, I know our media friends are, covering these things. Yung 590 na yan, that doesn't mean, I'm told that it doesn't mean that the hospitals cannot recover that.
Yes.
It's just that at the time that assessment or audit was made, yan yung lumabas. Pero marami dyan na-dispose na po.
Sana
Mr.
po,
President.
apo. Sana po ma-inform din yung COA so that in the future reports ma-reflect po nila yon.
Oo nga. Yes, actually, Mr. President, during one of the briefings this representation had with, DOH, no? Kasama yun sa natin, recommendations na closer coordinations with COA para yung ibang nafa-flag nila, napapaliwanag din kay COA if there are particular circumstances in the medical industry, in the practice that can be explained and do not have to, can address, can give acceptable answers to the red flags that are raised by COA.
Thank you, Mr. President. So,
Okay.
I want PhilHealth, feel free to correct me if I have misappreciated anything. No? The PhilHealth system works like this. We are all, Filipino citizens are all covered by PhilHealth.
That is correct.
Yes, okay. But for we to benefit from our coverage, we must be in a PhilHealth accredited hospital attended to by a PhilHealth accredited doctor.
Correct.
Mr. President.
That is correct, Your Honor.
So dalawa,
Mr.
two kinds
President.
of accreditation, di ba? So the hospital must be accredited as well as the doctor or the healthcare professional. Tama po ba yan?
May ganon. Yes, unfortunately, Mr. President, there are situations where the doctor in a hospital is not accredited, but the hospital is.
In that particular case, the patient cannot claim any PhilHealth benefit.
Paano ba nangyayari yun? Yeah, to be accredited. Pero Mr. President, the claim, if made by the hospital, will be denied if those two conditions are not met, an accredited hospital and an accredited doctor.
Yes. And then the benefits of the PhilHealth member will follow the schedules in packages in packages.
Yes, Your Honor.
Prepared by the PhilHealth. Okay.
It's known as case rates.
Case rates. Okay, Mr. President. So may mga ceiling amounts po 'yun. Okay. And for example in Mindanao, how many hospitals are accredited in Mindanao?
Okay. Well, Mr. President, they are looking up the the number for Mindanao, but what I have in front of me is the accredited hospitals in the entire country.
Ilan
And it's
po yun?
1,866.
Okay, maganda po yan. 1,866 hospitals nationwide.
Yes, sir,
Do we
Mr.
have a
President.
division as to the island groupings?
Wala. This is a nationwide lang, Mr. President.
Apa.
Meron daw silang Luzon, Visayas, Mindanao, but I don't have it on me. It will be
Yes, yeah.
given to
Sige,
me, Mr. President.
in writing na lang po. Ang
submit na lang.
concern ko kasi rito is, theoretically, all citizens are covered, but coverage would be
Limited in some areas.
useless, limited, or less beneficial if your area does not have any PhilHealth accredited hospital or just a few of them, and it takes an effort to access them, Mr. President. So
Yes, Mr. President.
I'll just come up with my own study if I'm given already the breakdown. Does PhilHealth have the number of hospitals nationwide? Not the accredited ones, but the universe of hospitals which can be accredited. Hingin nyo lang yun, kasi gusto ko i-analyze.
So, Mr. President, the inventory of hospitals is I know. I just want to see it again. What was it? Oh, see? That's why I want to see it. Mr. President, I am waiting for the correct figures from the agencies.
So, while waiting for the figure, of course, sige. Okay pa.
Okay, so tatanggalin natin yan. So dapat pala ito sinabi ko. Ay, hindi naman ako kinurek. It's okay. Di halos lahat pala. Okay, Mr. President, let me just make a correction earlier. When His Honor asked about the number of accredited hospitals, the number that I gave, which was 1,866, includes infirmaries, which is 583. So without infirmary, the number of hospitals is 1,283 accredited hospitals. Now, the inventory of hospitals is 1,286, meaning there are almost only 3 hospitals are not yet accredited. So that is quite a good number, Mr. President.
Yes, because ang next question ko sana is why would the hospital not be accredited, and if there are some hospitals which choose not to be accredited?
They don't choose to. Meron bang nag-choose not to? Sa una lang, baka bago. Ano kayang reason?
Konti lang, 3 hospitals lang pala. Ano? Pagkaalam ko may hospital na nag-opt out.
Yeah, well, we don't know, Your Honor. There's just 3 of them anyway, so we will check what's the reason those 3 were not accredited. It's possible, Mr. President, that they were suspended because they have also given suspension orders in the past, Mr. President.
Small number.
Tatlo lang naman.
3 out of 0.000.
So thank you for that, Mr. President. So kung ganyan yung figures natin, if there is a hospital in the Philippines, it's most likely
Accredited.
PhilHealth
Yes,
accredited.
Mr.
Okay,
President.
Thank you. Thank you for that, Mr. President. Now let's go to the DOH budget, Mr. President. The DOH has a public health program. We are appropriating 1.7 billion for the prevention of and control of non-communicable diseases. Is that correct, Mr. President? Is my figure correct? This is not the amount of the program. May sub-program.
Yes, Mr. President, 1.707 billion is allocated for the prevention and control of non-communicable diseases.
And then of this amount, the DOH intends to use 682.7 million siguro to. Million.
Yes, 682.7 million, Mr.
Million,
President.
yes, for the purchase of mental health commodities, Mr. President.
That is correct, Mr. President.
And what would be included in the item mental health commodities, Mr. President? Procurement ito ng items.
This is 30 medicine and this is projected to expand to 515 access sites for 225,000 plus service users
225.
identified with mental health conditions.
So this, our users have already pre-registered, Mr. President, under this program. Ganun po ba yun?
Yeah. They have been assessed or at least somehow documented in the health centers. That's why we have that number, Mr. President.
Okay. And
Okay.
the beneficiary must be an indigent, Mr. President?
Okay. Mr. President, as long as they are registered patient in the center, they will be assisted. Mr.
And
President.
the assistance is in the form of giving them the medicines for free.
Among others, counseling. Mr. President, medicines is just one component of the assistance being given.
What would be the other components, Mr. President?
Counseling, Mr. President. Consultation and then counseling and basically access to treatment. Of course, I will assume that is in areas where we have the professionals that can provide. Obviously,
That's-
some areas would have a broader broader kinds of services available. That is one of our objectives, Your Honor, in the bill that this representation filed and is hearing on the human health resource management, Mr. President.
Because my next question, Mr. President, is yung mental health professionals. The number of psychologists, psychiatrists,
Yes.
they are of course involved in the program. Their participation is indispensable in the program. So, and I think ano ba yun? From the bill of Senator Gatchalian, which was about
We passed
the
already
mental health awareness in schools.
in
di ba?
schools.
So he clearly informed us that of the shortage of the psychologists and psychiatrists.
And even the guidance counselors,
and guidance
Mr.
counselors.
President.
So whose concern is that, Mr. President, to generate more interest in these fields and actually to have actual graduates in these fields, Mr. President? Is that the concern of the DOH?
Mr. President, this representation actually has handled the budget of DOH for this 4th year and the budget of CHED for the 5th year. And every year, I remind the two agencies to work together because CHED needs to understand the depth of the health human resource crisis, and DOH needs to identify the various various professions that need to be prioritized, and then as His Honor correctly pointed out, Mr. President, to encourage our high school graduates to consider these professions. In fact, this representation is a supporter of strengthening the scholarship programs in those professions that we need. But that is this representation, Your Honor.
Under this program, Mr. President, this prevention and control of non-communicable diseases, where we have mental health let's call it just a sub-program, Mr. President, are families with members or children who fall within the autism spectrum also beneficiaries of this program, Mr. President?
Yes, Mr. President.
So if diagnosed to fall within the spectrum, they can, and they have been prescribed medicines, they can go to the what are the centers, Mr. President? The Barangay Health Center, Mr. President? Ito ba?
What is the question? What is the...
Where is that? So if there are families now listening to us that they have a member who has been
hindi.
diagnosed to fall within the autism spectrum, can they approach this center? Is this the Barangay Health Center for this program to access the 30 medicines that we say are available, Mr. President?
It doesn't fall under the budget that I discussed for the mental health commodities, but they will be a referral. But I'm sure it's in the stage of training, not every barangay center and identified. So if they are properly referred to a specialty hospital, then yung budget natin, that's fine. I guess the consultation, yes, pero but medicine. Mr. President, I just had to clarify. In the earlier discussions on the commodities for mental health, the diagnosis for autism would not be, a diagnosed patient as autistic would not be a recipient of that same budget. So first, what would happen is, ideally, they are properly diagnosed, or at least if there's a suspicion of autism, they would be referred to a specialty center. So the first issue would be the proper diagnosis, as His Honor would know. Once they are referred to a proper specialist, and this would be a pediatrician, then that is the time that this patient would be able to receive outpatient consultation for free in DOH hospitals. But if therapy would be needed, and perhaps for some there would be a need for therapy, so far that is not yet covered by the budgets that we have. But these consultations are free, and that's covered by the DOH budget, Mr. President.
Okay. I think there are some situations where someone falling within the autism disorder spectrum
Okay.
would also be prescribed medicines. So hindi pa siya, this program, itong specific na pinag-usapan natin na may 30 medicines as mentioned by our sponsor, wala po. These are other mental health conditions, not autism.
But not here. It's not part of this. What was the mental health? Yeah. So, Mr. President, there would be incidents, there would be cases where a patient diagnosed with autism in extreme cases would need medication. But as I said earlier, it would not fall under that budget for the mental health commodities. Iba hong budget yon. And wala.
There's a program for them?
O yun nga, wala. No. So wala.
Actually, basically, yun po yung tanong ko. Is there a program for them?
Pero nagbibigay ng gamot? But that's services, hindi gamot. Services, yes. So, Mr. President, we have specialty hospitals. We have a list of hospitals and clinic with developmental and behavioral pediatricians. The consultation, as I said, would be covered by in the DOH hospitals, and in particular, PCMC has a budget for the services, but not any medications if needed.
Yes, ang difference kasi, Mr. President, is itong ating public health program where we found this 682.7 million is implemented nationwide. Tama? In barangay health centers. Tama po ba? So yun po ang expectation nating kababayan. Pero unfortunately, when we talk about autism, we're talking about Philippine Children's Medical Center, which is located in Metro Manila, Mr. President. That's the problem. Masyadong centralized na po pagdating doon. So may we know what are these mental health commodities na 30 medicines under this program? What mental health conditions are they intended to address or to help, Mr. President?
Mr. President, would His Honor like a copy, or would you like me to read the
Sige.
30?
No, sige lang. Not to read the names of the 30 medicines, but what are they meant to alleviate or to, if not to cure, Mr. President? What kind of mental health condition? Yun na nga kasi suicide niya.
Meron pong para sa obsessive compulsive behavior, may for epilepsy, depression, anxiety, psychotic disorder, and dementia, to name a few, Mr. President.
But from the point of view of the DOH and the architects of this program, is autism also a mental health condition?
Is what? Sorry?
Is autism a mental health condition?
It's considered a developmental condition, Mr. President.
So technically, it's different from a mental health condition. So you did not design this program to address or to help people falling under the spectrum.
Mr. President, the support needed by persons in the autism spectrum would be long-term therapy, such as occupational therapy, physical therapy, speech therapy, that kind, Mr. President. So a little bit, I guess is it correct to say the treatment is very different. Maybe there's a big range, as His Honor correctly pointed out, it's a spectrum.
Sige, but it looks like the DOH also concerns themselves with the autism spectrum. So is there a program that the DOH can point to where there is funding to help persons falling within the spectrum as well as their families, Mr.
So
President?
lahat ng public hospital,
Yes. So, Mr. President, all the public hospitals who have developmental pediatricians would have that program. We can ask DOH to furnish us a list of these hospitals with the developmental pediatricians, Mr. President.
So some lang, in some of these DOH-run hospitals, not in all.
Yeah, I heard. So, Mr. President, yes, you
Some,
are,
okay.
His
So-
Honor is correct. Just a few hospitals would have, like UPPGH, PCMC, the Medical City, the La Salle University Medical Center, and the National Children's Hospital. Just to add, we've had discussions with some of our colleagues, and it's actually very difficult to get an appointment with a developmental pediatrician. So I think this just highlights the need to really have more planning and to even provide scholarships and encourage more doctors and students to consider these professions. From what I know, I'll just add, Mr. President, a lot of because I was asking time and again, I asked undergrad for med school. So nawawalan din tayo ng practicing psychologists, and dinamay ko na rin yung kwento ng nutritionist kasi ganun din, shortage.
Sige, and if you notice the names of the hospitals,
Private.
Metro Manila centric.
Metro Manila, yes.
And it shows siguro that the practice basically is here, only in Metro Manila. Wala tayong practitioners in the province. Okay. Sige po. Thank you for that. Thank you for the
Mr.
information.
President, there are all over the country, pero syempre, I'm pretty sure mas marami po sa Metro Manila.
So
We
the
have-
list is more than those Metro Manila hospitals?
Yes, Mr.
Okay.
President. 34 private hospitals in NCR, 22 private clinics, 3 public hospitals. But that's NCR. And then, meron din akong list for other areas, but mas konti po.
No, when her honor mentioned the private hospitals, I mean to say,
Yeah, because you gave me
salo,
4 names.
yung gastos doon, salo ng DOH? Or you're just informing us that there is a psychological services in the
Yes.
private hospital, but that's not part of the program. And I'm asking about the DOH program.
Training. Okay. Mr. President, to be clear, the 5 hospitals or institutions that we mentioned earlier are the ones that offer training in developmental pediatrics. Okay, 5. But, Your Honor, we have a list of hospitals and clinics with developmental and behavioral pediatrician. And as mentioned, in NCR, 34 private hospitals, 22 private clinics, 3 public hospitals. And then I have Southern Tagalog, Southern Luzon. There's also in the Visayas and Mindanao,
Sige, thank you.
Mr. President.
Thank you, ma'am.
Yes.
Thank you. Siguro I'll just like to appeal to the DOH that in the name of...
Mindanao, Mr. President,
yes,
10.
ma'am.
7 private and 7 private hospitals, 3 private clinic, private lahat. Tama ba to?
Private lahat. Sisibihin nun,
Tama ba to?
hindi rin matakbuhan ng mga kababayan natin doon. And of course, although the practice is here in Metro Manila, I do not think it's worth it na, they will transplant from Mindanao to Metro Manila for that purpose, Mr. President. Tapos ang haba pa rin ng waiting list and how many families can afford to do that. So siguro an appeal to the DOH, although on paper you have a mental health program and people might think nakasama yung autism doon, clearly it is not. So if you can develop, DOH, Mr. Secretary, a program for people, especially children, falling under the autism spectrum, Mr. President. If you can make this a difference, sabi mo, developmental situation, condition, so maybe you give it the appropriate name, but if we can make this into a program under the DOH, then request for funding, then we'll do our best to help you, Mr. President, Mr. Secretary. This is just an appeal, ma'am. So,
Isn't autism just one type of developmental condition? So, I just want, kasi nasagot ko yan, dahil hindi lang naman autism.
sige. May we get the
Yes.
stand of the
Mr.
department?
President, I was just clarifying with DOH that autism is just one of quite a number of developmental conditions. So, to be clear, the programs that DOH has to make available is not just for autism, but for also other developmental conditions. Kasi marami po yun, no? And of course, there are different societies and groups that work together with DOH, work on their own. But I just wanted to put on record that it's not just autism. And I failed to mention, it was mentioned to me 2 times, that PhilHealth actually has an autism package. Is it the Z? The Z? Okay, so they have children. So tama kayo, yung sa inyo nga is children with developmental disability, not just autism. Iba-iba yan. And yung package nila, that's for what? Anything. Services, medicine, anything?
Yes.
Pero one-time use lang yan. Yeah.
Wala
So
titingin.
it's not a big amount, but it's a start.
How much?
3,626 to 5,000. How many sessions can you have?
Maximum number of sessions.
Member ako. Anak mo 5 years old. So yan, i-claims, dadalhin ko siya. Sa private. Tapos PhilHealth, siyempre. Yun may package sa kanya. Sa anak.
Walang medication. So, pwedeng rehab.
Pero at least meron naman. Sinabi naman ni Pia, at least meron.
Mr. President, that package is per session and they can avail of 10 per session. So that's not bad. I have to laud PhilHealth and DOH for working on this per session.
Per se- 10.
Maliit pa rin yan kasi alam natin na mahal, but it's a start.
10 in a year.
10, you can avail of 10.
Is it a year?
Yeah, so roughly one a month, one session. It can be used for different kinds of therapy, like the speech therapy, the occupational therapy, the consultation. And then, ito yung accredited. Yun lang, konti pa lang accredited because I guess they have to go through the accreditation process, so baka pwedeng dagdagan kung sino yung meron. So it's in UPPGH, Eastern Visayas Medical Center, and SPMC. Southern Philippines is the one in Davao. So at least may Luzon, Visayas, and Mindanao na government. Pero pwede kayo mag-accredit ng private kasi pwede naman, 'di ba? Pwede kayo mag-accredit ng private. I was about to say that. Kasi this will not cover the whole thing eh. Oo, okay. So they know they can accredit, but for a middle income family, malaking tulong na 'yan. Kasi kahit kumikita yung parent ng 30 or 50,000, nakakabawas pa rin yun dun sa gastos.
If I may, Mr. President, if I may just interject quickly, Mr. President, I think it's commendable and I'm happy to hear that there is such a program like this. But at the end of the day, the sponsor is correct in ensuring that there would be more accredited centers. But more than that, Mr. President, is the challenge of looking for the right experts to look into it. More therapies, more OTs, more speech therapists, Mr. President. Because until now, I believe there's quite a huge gap when you talk about the requirement, Mr. President, for experts and therapists to attend to child development concerns. Thank you, Mr. President.
Yes, thank you, Mr. President. His honor is correct.
And thank you to PhilHealth for volunteering information. But actually, my question was addressed to the DOH. If you can design your budget in such a way that you have a public health program, then you have an amount for the procurement of mental health commodities, 682 million. Can you not design your budget in such a way that you will have a program for the developmental situations or challenges, Mr. President? Itong program yung mental health, gumawa sila eh. Oh. Can they not have also? Can they not help also those short of mental health, but you say developmental situation or condition, Mr. President?
Is it absorbed in their own budget?
Yes. Tama. But baka pwede na hindi siya
So, Mr. President, to be clear, because we only have 96 developmental pediatricians, then the ability also to roll out those programs is a factor. But the hospitals themselves, where these doctors train or practice, have budgets there. So yung nabanggit, so hindi ko pa ho naiisa-isa yan dito. There would be budgets, let's say in PGH, may budget yan. PCMC, may budget yan. So we can pull out those separate budgets. So unlike yung sa DOH na mental health budget na isang lump sum, nakaspread out sa hospitals yung programs depending on the hospital's service offering. So per hospital natin makikita.
But that was mandated by the DOH. We're talking about hospitals, ano ba tawag mo doon? DOH run hospitals, tama?
Occupational therapy.
That means it's a control. It's control. It's a control power of the secretary over the hospital, tama?
Mr. President, to be clear, this is how it works for the developmental PEDS program. So if once diagnosed, i-refer sila, let's say, occupational therapist, speech therapist. So those centers are available in those hospitals. So isa-isahin natin yung hospital to see
Sige,
yung
okay.
occupational yan, does not only cater to autism, pero lahat ng may developmental, no? They cater to them sa occupational. But again, having said that, your occupational therapy center would also be catering to stroke victims, di ba? So hindi naman yata nakaseparate po yun. It's just that service and cerebral palsy. So yung service is there. The service is there. And developmental conditions are part of the patients with developmental conditions are part of the patients that receive the services within the hospitals that have those services.
Okay, so we'll just get feedback from our constituents, Mr. President, when they try to avail of the services as we have announced tonight. So, tingnan po natin.
And DOH is committing to us that they will expand those services, Your Honor. But I am also telling DOH that your ability to expand will be limited by the services, the equipment and the infrastructure, pwede magdagdag, pwede maghanap ng pondo. Pero yung tao, that will take time. So kindly work with us very closely because we have fully funded every year the Doktor para sa Bayan, and the intention is to also fully fund the allied professionals that we need to complete the whole wellness services that need to be made available to the Filipinos. So we need the input coming from DOH. Thank you.
So thank you, Mr. President. At least we have, at least tonight we focused on the topic. So the DOH family is attention has been brought to focus on that topic. Talking about the same public health program, the same 1.7 billion pesos. From that amount, the DOH will use 1.02 billion pesos on cancer commodities. Okay. How can this program be accessed by our constituents, Mr. President? Kasi kung marinig na, alam mo, prevalent na rin po ang cancer sa population. Marami pong problema na ang cancer. So when they hear that you have a public health program, you have 1 billion pesos to be spent on cancer commodities, how, yun ang mechanics po, how can the concerned parties avail of the benefits of the program?
These are just the medicines, yes. Pero yung 1.0 is purely the medicine. Yung iba. Yung ibang services, uncovered yun. Wala dyan. Okay, but I get it. Okay, Mr. President, the 1.02 billion is for cancer medicines and commodities. This is 61 cancer medicines for 31 access sites. And this is projected to be expanded to 34 access sites with target beneficiaries of 33,802 estimated service users. But we just like to add, Mr. President, that the cancer control programs is not just medicine, but it also includes surgery surgery and radiation therapy, Mr. President, which is an addition to the 1.02 billion budget for medicines that was mentioned. Mr. President, 80% of cancer are bulk forming and amenable to surgery and radiation. So I recall at my very first meeting with the secretary, he discussed this with me because you are a surgeon, right? Yeah. So he is a surgeon. Hindi, kasi you're many things eh. Kaya sinisigurado kong tama yung masabi ko. He's a surgeon and very familiar with the needed interventions, and he was explaining to me at that time, not now, that yun nga, with early detection, surgery, radiation, a lot of this would be life-saving interventions, Mr. President.
Sige po. And those are available in the DOH-run hospitals. Ganun ba yun? Ganun, okay.
Yes,
How
Mr.
about
President.
PhilHealth? Does PhilHealth have any cancer packages, Mr. President?
Excited po silang i-report. So, antayin natin, Mr. President. So, Mr. President,
Galing nga eh.
the Z benefit package rate for cancer for acute lymphocytic, do I say that right? Lymphoblastic leukemia, it's 500,000. For breast cancer, it's 100,000. Prostate cancer is 100,000. Colon cancer, 150 to 300,000. Rectum cancer, 150 to 400,000. And cervical cancer is 120 to 175,000. Yun lang, wala yung iba. Yun, meron pa.
Good. we
Meron
have-
pang iba, Mr. President,
Yes,
but to
thank
give you an
thank
idea.
Yes, to give us an idea na meron.
Okay na.
Apo.
Yes, Mr.
And that is what
President.
is important po na during the budget process, malaman po ng taong bayan saan
Meron.
pumupunta ang pera nila, Mr. President. So, Mr. President, since we mentioned some DOH-run hospitals, is the Mariano Marcos Memorial Hospital and Medical Center one such DOH-run hospital? Is that
Yes, it is, Mr. President.
Siguro, just to bring to the attention of the Secretary na there's a mention in the COA report about its very low utilization rate, Mr. President, 38.3%.
Yes, Mr. President, we are aware, but we'd like to point out that as of October 31 of this year, the utilization rate is 77%. I've asked my staff to study this historically, and normally when the COA makes its report, it's not yet towards the end of the year, so the utilization rates tends to be lower, but by the end of the year, they have a good utilization rate, Mr. President.
Was that how, are we talking about the same time period? The COA report is a 2022 COA report. So,
Well, I'm talking about October 2023. The
2023,
utilization,
sige.
the
Okay.
obligation is 80% and the disbursement rate is 77%. Do we have the year before?
okay na po yun. So apparently,
But at least
the
at least we know that,
hospital already,
yes,
yeah,
Mr. President, thank you.
siguro took into account the COA finding and addressed the COA finding to make sure na hindi maulit sa next year. Apa. So, but PhilHealth is here. Meron kasing phoned in naman question po na the member cannot avail of PhilHealth benefits unless you spend at least one night in the hospital.
Yeah. So, Mr. President, that has been the situation from the very start because the benefit is an inpatient benefit. That is why, Mr. President, for many years, the goal was to be able to roll out the outpatient benefits. Kaya po nagkakaroon din ng issue, I'll just mention it, na
Tama yun, tawag sa atin.
I don't know how rampant it is, but there would be times that a doctor would just insist that the patient would stay and admitted para nga maka-avail. So that is the sad reality of when we start a program, it usually is a inpatient program, and that's why it's very important that we are able to roll out the outpatient program, Mr. President.
Okay. So, meron na?
But you'll avail of that. There's a different emergency package. Mr. President, they are now developing a package for emergency cases to address a lot of incidents where hindi naman talaga kailangan mag-overnight, Talagang emergency case. I'm glad you're developing that finally. Kasi ang tagal ko nang
Kasi
naririnig yung
from-
issue na yan.
From experience,
Initiative of our Secretary, Mr. President, thank you after all these years. 2 decades na po akong nag-aantay niyan.
Stay overnight. Ano sabihin?
19 years to be exact.
Well, from experience, Mr. President, sometimes nag-overnight naman tayo sa hospital, but we are not an emergency case.
No, Mr.
So
President,
what's the
we
point,
are,
Mr. Why? And it is not the law which requires the benefits to be extended only to inpatient, di ba? Siguro yun lang yung program na ginawa ng PhilHealth. So
the law really requires
Is it the law? Is it the law which requires that it must be an inpatient care, meaning to say one night in the hospital before benefits can be extended?
Sinasabi nila outpatient, pwede naman sa emergency.
Yun na nga, bakit nga?
Mr. President, it is in the law, itong inpatient claims, no? But to be clear, there are claims ever since naman that are considered outpatient na nako-cover naman dyan. You
Okay.
don't have to be an inpatient. Can we mention a few? Because I think that's what the minority floor leader would like to share with the public. Pagka kunyari,
But it's not only that na meron, but has it been communicated clearly to both the hospital and the public na meron palang ganun? Because reaction po yun ng isang constituent natin na nagre-react sa ating exchange ngayon. Na
I think, Mr. President, it's important that we distinguish and perhaps yung, kaya nga ako, I'm a supporter of health promotion. Ewan ko, kasama yan sa budget ng PhilHealth, na alam nga naman ng tao. Kasi ngayon, pinapaliwanag po sa akin, yung mga kunyari, suture, kasama yan. Pero pag kunyari, ikaw ay inuubo-ubo doon, eh, pauwiin ka talaga ng ng hindi kasama, di ba? Walang kasama yung gamot. Resetahan ka lang, pero uwi ka na wala kang O example, ako na magtatanong ng example, hinika ka doon, o pag tinreat ka doon ng may, ano tawag doon? Nebulizer. Ano yon? Covered? O walang claim yon, Mr. President. Yung
Bakit?
nebulizer, ina-asthma. Kasi nga, it's not
yes.
it's not considered an inpatient eh. So, pero possible na emergency yun kasi 'di ba pag hinika ka. But dinedevelop pa lang yung program. Dinedevelop pa lang, Mr.
No,
President.
we will limit it to inpatient if it is because of some legal mandate. So can the PhilHealth give us the section and the RA number of what this law is na ganyan?
Yes, we can provide, Mr. President. Just give them a second to pull out the law.
And yet, in spite of that fact, the PhilHealth is developing an outpatient program or packages, Mr. President?
Yes, Mr.
Are they
President,
developing
matagal na. Taon-taon natin to
Hindi,
pinag-uusap.
meron na. Meron na.
Meron na, pero as far as it's in the it's required by the UHC law that this is rolled out, and this is not yet because it just started, no? So I remember last year pilot, so medyo pilot stage pa rin. They now have the consulta package. There's primary care service, which is consultation and case management for any condition, preventive health service, assistance in accessing services in partner facilities, referral to specialty and higher level of care. Then they have 13 laboratory services, ito yung mga CBC, urinalysis, pap smear, etc., blood sugar, etc. And then 21 kinds of drugs and medicines are now available in this consulta package. But currently, this is only available in 2,428 accredited providers. And I'm quite familiar with this, Your Honor, because this representation has been urging DOH and PhilHealth to roll it out on a pilot basis para they can find that sweet spot. Kasi may gastos to, Mr. Presidente. So it's a question of how much does it cost per patient to maintain and to sustain this program?
Sige po. Pero ang dental concerns, hindi kasali sa PhilHealth? Dental concerns. Medyo ano tayo dyan I think we should address that. The dental health, the oral health, no? Oral health of our population, Mr. President.
Wala pa. Pero ano yung chances na maano? It's not yet included, Mr. President.
Included? PhilHealth has packages for...
No, it's not
okay.
yet.
Okay. The non-inclusion of dental health concerns or oral health concerns is because of a legal impediment or hindi lang po nagawa ng package ng PhilHealth? Ano sabi ng law? Bawal din? Actually, marami tayong problema tayo.
Pero yung ano ba, ang tawag doon, yung magpapaklining ka, ganon, wala. We will sa konsulta. Okay. So currently, Mr. President, the only thing that is covered is extraction with suturing. So in other words, kung nabunutan ka na hindi naman kailangan tahiin, bahala ka sa bayad mo.
Kailangan
So
may ano.
siguraduhin mong duguin ka para makasama yung ano. Hindi, ganun eh. Para maintindihan ng
Yeah.
tao, di ba?
Yeah, but I think that should be, akala ko ang direction natin is preventive or overall
Yes.
health maintenance.
So actually, Mr. President, that's a good
Huwag na natin
observation.
pabayaan mag-hemorrhage muna bago,
Of course.
bago
No, actually, Mr. President,
chargeable.
dito sa konsulta, ngayon makakasama dito, Mr. President, yung check-up. Sa konsulta. Konsulta is the outpatient. So this is really preventive.
Yes. If we can extend the programs to konsulta na, can we not extend it to dental concerns?
No, as I was saying, Mr. President, yung check-up ng dental check-up will be part of konsulta. So what His Honor is saying, and I suppose it's I mean, honestly, antayin mo bang bulok na yon para pagbunot, duguin, para makasama, di ba? Parang yun nga yung point ni Minority Floor Leader na, di ba? Parang,
Sige, anyway, that this be just a challenge to the PhilHealth, Mr. President. Unless they tell us nga that there's something wrong with the law, it's the law which prevents them from using their imagination to come up with packages which help our people, Mr. President. Then, balik ang bola sa amin, we amend the law. Pero kung hindi, the ball is in your court and just use your imagination. Paano tayo, we're out here to help eh. And I think marami may problema with oral health or dental health, Mr. President. Ano ba tawag mo doon? Oral health? Dental health? Oral health? Pares na yun? Hindi ka naman dentista, nurse. So, tawag kayo sa dentist. Tama.
So sa DOH to, parang vaccination. Oo, okay. So, where is this available? Through public hospital?
Punta na ako sa COVID na. Tapos na. COVID na tayo. Bakit pa?
So actually, Mr. President, to be clear, it's not just PhilHealth that has initiatives for oral health, also DOH. So they have a budget of 515 million for fluoride varnishing, glass ionomer for art, ano yun? Pang cleaning lahat yan. Okay. So anyway, just to be clear, the conditions that are being addressed are the glass ionomer is for restorative treatment using minimal instrumentation and low resource setting. And then anyway, it's kind of technical, Mr. President, yung treatments, but the point is they have 515 million available in health centers. And I recall, Mr. President, that a lot of LGUs, because His Honor will recall that healthcare is supposed to be also devolved. I recall in my visits to the countryside, there are quite a few LGUs that have already included free dental packages. So this is not a PhilHealth reimbursable. This is a service of either DOH or the LGU. Parang vaccine po, di ba? Hindi naman ho yan PhilHealth eh. It's a, how do you call it? It's a national program, Mr. President.
National program administered by the
DOH.
Yes, yes.
Oral health, Mr. President.
Sige po, basta na-announce natin ngayong gabi that there is a program, it's in the barangay health centers, in the form of commodities din ito? Or is a
And
service?
Services, opo.
Services? Our barangay health centers are equipped with dental chairs, Mr. President?
Yeah, so Mr. President, itong program ng DOH includes prevention. This is the routine, preventive, and essential curative care. So ito yung check-up. And then screening.
Okay.
Ito yung oral health screening integrated, yun nga, dun sa check-up. Yeah, that's it, Mr. President.
Sige pa, okay. At least na-announce natin ngayong gabi. Ngayon, I see Dr. Sarate is here of the FDA, so ibigay ko na lang po sa kanya yung mga reklamo na tanggap ng opisina ko. But basically, it's the same as last year's list, Dr. Sarate. So, but it's not, I will have to admit, it's not as passionate as last year, yung reklamo. So, maybe there have been some improvements. So, it's the same nature of complaints, but not as passionate. Last year, grabe yung text na natanggap ko. May mga kasali pang mga curse words eh. Ngayon, wala po tayong natanggap na ganun, Dr. Sa. So I hope that's an indication that there have been some improvements, Mr. President.
Mr. President, the Director General was saying to me that they are in the process of digitalization.
As of now po, ma'am, we're already 90%.
Delay lang yun,
But
ano?
the problem with the old system is the payment system. But we're addressing it right now.
So here po, if you open that.
Payment nyo, bakit?
There are two types, e-portal and e-services.
Oh.
Those e-portal, magbabayad sila sa land bank para magkaroon ng yung payment sa amin.
Oh.
Pero if you are in the e-services, may automatic extension. So lahat ng mga format kami, pinamigrate ko na po sa e-services para automatic. So
Okay.
it's more
So it's the payment system, Mr. President, that they are still working on, as it's not yet that user-friendly. Actually, I just want to add to that, even though it's not the question of His Honor. Until, I think, a month ago, actually, my brother was trying to access the FDA site. And there's a notice there, an advisory that says, what? Under maintenance. No, but wasn't there, yeah, it's only available 9 to 5. And takang-taka po kami kasi, ano ba yun? Parang araw-araw after 5 p.m. sarado yung digital portal nyo? And that was there for like 6 months.
Ma'am,
So this is not the question of the minority floor leader, this is the question to myself.
Yes, yes.
we're migrating the system.
Because I'm not aware of the...
Pero ngayon lang ako nakarinig ng ganun eh, na 9 to 5 lang.
Apo, ma'am, kasi po we're migrating to the e-services po. And during the time na po nakakabit sa
I am making known that concern kasi I'm just saying, I've never, ever encountered, I don't know if any of you have, a site that tells you na open lang siya na 9 to 5. Wala pa akong nakitang website na yun. It's possible na sabihin sa inyo na ang aming, ano tawag doon, our
Office hours.
our office hours are 9 to
operating
5
hours,
or
yeah.
our personnel will only get back to you at 9 to 5. Pero to be able to punch in something, never ko po narinig na 9 to 5 lang yung ganon. So I just want to put that here on record kasi yun nga, never, ever, and pati yung staff ko, pina-check ko, wala ho kami naririnig na ganon, na buong, yung hindi ka man lang makapag-submit ng data after 5. Digital nga lang yun. Kahit not, it shouldn't be that difficult to be able, ang explanation is, sa gabi daw nagtatrabaho mga tao, naintindihan ko yun. Pero there's got to be a way that you can submit things even after 5 digitally.
To receive the information.
Yeah.
Tama po, ganun po.
Anyway, let's give the floor back
9
to the
5,
minority
so sabi ko
floor leader.
8 hours lang yun, so 16 hours of the day wasted although you're available online. So,
Yeah.
Anyway, I adopt the question of the sponsor
Thank
as my
you.
own.
Thank you.
Thank you. So anyway, Dr. Sarate, yung complaint talaga is actually the delay. So please find a way.
Yeah.
Just like you think like you're a court, reklamo sa court system delay. So ganun po.
And then, asan na yung letter niya?
So
With the permission of the minority floor leader, may question lang si Senator
yes, of course.
Legarda. Banggitin ko na rin kasi it's also about yung tungkol sa, alam niyo na yan? Alam niyo na ba? Sa, yun. Anong pangalan nun? The drug is called... Correct. Pero may application na ba sila? Mga kailan yan?
bakit si LTFRB kita na?
Is the generic name is remdesivir or magkaiba? Bakit? Sabi nga niya, say it again.
Remdesivir.
Molnupiravir.
Amondopir.
Pero ang letter na pinadala ni Senator Loren is remdesivir. So pareho yan
Remdesivir,
nasama
sa
dun
COVID
sa
yan.
pagtanggal ng emergency. Oo. Anyway, so I explained to Senator Loren, kasi sabi niya maraming pulmo doctors na lumapit sa kanya na the process must be followed, and that is the registration with the FDA. So we will make appeals to the FDA to expedite, without cutting corners and ensuring safety, the registration of these products. That's why I was asking kung may pending applications. Meron naman.
Created ma'am task force for the facilitation of registration for for the COVID oral medications.
Okay.
As of now, the molnupiravir has 4 application on evaluation.
So, ongoing yung evaluation nitong mga medicines. Kasi nga, kahit na na-declare na natin na the COVID pandemic is over, but there are still cases, and for those who are immunocompromised, the doctors need to provide this kind of medicines, at paubos na daw po yung supply. So, would His Honor like to adopt that question
Yes,
as well?
I make the question my own, Mr. President.
Thank you.
Because my next topic is about COVID-19 actually.
Okay.
That's my last topic,
Okay.
Mr. President. Pero before we leave the FDA, can the FDA help us or the Secretary help us? Because we've been studying the budget of the DOH. Where can we find the total amount in the DOH budget which is appropriated for the FDA? And how much is it? Hindi pa namin makita.
Oo. We have that, Mr. President.
Ayan, kunin nyo. And if we could, it could be also categorized by expense class, yung PSMOE, if possible, Mr. President.
Yung PS.
Yan po. Yung appropriation sa
Ay,
automatic
note niyo.
appropriation.
So, ano ba to? So, anong babasahin ko dito?
Ito PS ito, 499.324 million. Yung,
And then,
and then, yung po at automatic nila is 1.19 billion.
499 plus 119.
Apa.
Plus, that's plus. So, the new appropriation, Mr. President, is 499.74 million. And then there is an automatic appropriation which comes from the income collection from fees, fines, royalties, and other charges. And that is 1.19 billion for a total of 1.69 billion.
Is the budget of
Sorry,
the...
Mr. President, can I ask our SecGen to check the aircon? Biglang uminit po. Thank you. Thank you.
Section, please, or we'll ask the Sergeant at Arms to check the aircon.
Thank you. Anyway, please proceed, Mr. President.
Yes, is the FDA budget also subdivided into expense class, Mr. President, like PS, MOE,
Yes,
CO?
I've asked for it,
yes.
Mr. President.
Expense class ba tawag?
Correct, oo. Asan dyan?
PSM.
So, Mr. President, saan tayo sa, ano basahin ko? The PS, Mr. President, is 194,797,000, and the MOOE is 101,713,000, 101,713,000, Mr. President.
Hindi po ba, ano yun? Akala ko 1.6 yung billion ng budget po nila.
Kasi automatic appropriation.
Hindi, automatic appropriation yun. So for the new appropriation, ano lang po sila 180, ay, tama ba?
499, I think, if I remember correctly.
100, ay, Bureau of, sorry, nag-move yung aking screen. Napunta na po ako sa Bureau of Quarantine. 499.
Yes.
499.74, Mr. President. So that was the
Did it add up?
Yeah, I'm checking, Mr. President. Parang hindi eh.
Hindi nga, Mr.
It
President.
didn't seem so.
Ito pinakamahirap na budget at billion.
Walang CO. Walang CO yun. Yung binasa ko.
Tapos yung 1.1B na automatic appropriation para sa...
Yung binigay po kanina is PS lang po talaga meron, 499.
Ah,
And then yung CO po kasi is as a
hindi.
special.
Ba't nagbasa ako ng MOE? Ano ba na ba? Mr. President, I'm sorry. For FDA, the PS is 499,742. Walang MOOE and walang CO.
Tapos nasa automatic
And then,
appropriation.
under the automatic appropriations nila kinukuha, yung
Correct.
para sa kanilang MOOE. And then may CO kayo?
What is,
Okay.
so CO will be taken from the automatic appropriation?
Yes, Mr.
And what would
President.
what would be the amount of the CO?
Ano yun? Asan?
675
675 million, Mr. President,
per capita.
for capita CO. Ito, yung doon sa automatic nyo. Yes, Mr. President. Sa alabang pa rin yan? Phase 2.
Yung for the 2024, yes.
Oo, for 2024, ito nga, itong CO po is for their phase 2 of their FDA,
of
Mr.
their office
President.
buildings. Okay, sige pa. That explains it. So Mr. President, ito na, siguro last topic na lang po ito. I've read in the news that some countries are undertaking a review of their COVID-19 response. What is the sentiment or the stand of the Department of Health on this subject matter, Mr. President? Should the Republic of the Philippines undertake a review of our COVID-19 response?
Definitely, Mr. President, that's the answer of this representation, and the Secretary is also saying that they have already, and the details are,
We have already a pandemic preparedness and response plan that was crafted by the Interagency Task Force. Ma'am.
yeah, I know,
That's
but
already
ang tanong is,
How much did you spend? Ano na yung bakuna? Ilan namatay? Ilan ano? So, tanong, i-remind mo ko sa mga tanong.
well, Mr. President, yes, definitely they have done it. And,
They've done it?
Yes, they have done it.
Is there already a final report?
Submitted to the Office of the President? It has been submitted to the Office of the Executive Secretary.
Okay. Only to that office. Doon pa lang. And limited, yung kanyang publication ay limited lamang doon sa opisina yon. Nobody else has access that, no other office or agency has access the final report?
Mr. President, this representation offers to file a resolution and then invite DOH to present those findings in that report, Mr. President.
The
with
report is not top secret, so it can be shared with with the Senate itself, Mr. President.
Yes.
At the earliest possible time?
Yes.
Okay, so good. Because does the report contain the total amount that the Republic of the Philippines spent to respond to the COVID-19 pandemic? Is it there?
It was not a financial
No
review.
financial.
It's a response without
Okay.
yeah, the financial.
The effect of our COVID-19 response to our total national debt, is it there? Wala din.
Wala siguro, Mr. President, kasi nga, it's a technical review, Mr. President.
The total number of vaccine vials or shots that we procured
We have, Mr.
as part of
President.
our okay,
We have
the total number of vaccines that we accepted as donation. We have
Meron, Mr. President.
the total amount of the vaccines that were wasted. Is that also reflected in the report, Mr. President?
More or less, Mr. President, lahat po yun available.
May I know the vaccine wastage, Mr. President? Total amount, if not in the number of vials, Mr. President? Sa hearing na lang natin i-find out yung effects sa finances sa hearing. Gastos, inutang, sino nagpautang. Kasi billion yan eh. Trillion siguro.
Mr. President, my short response will include a short explanation. I'm already foreseeing the follow-up questions, so His Honor can sit down. Mr. President, the vaccine wastage, or the COVID vaccine wastage is 49,730,000 doses, no? The reasons for this wastage are expiration beyond shelf life. Napakarami po nun kasi nga yung binanggit ko na 49 49.7 million doses. Of that, it's 38.54 ang expired or beyond shelf life. I would like to emphasize, Mr. President, that napakaiksi talaga ng shelf life ng COVID vaccines. 6 months po yun. And then, yung mga na-donate pa ho is 3 months. So, it's really, it's actually, meron pa nga daw ho 1 month lang ang shelf life. So, it's something that, in a way, I don't know if it's correct to say it, but in a way, it does not surprise the experts because with a shelf life that short, talagang ma-e-expirean po tayo ng ganon.
Of the 49.7 million doses wasted, mga 500 pesos per vial siguro should be a safe amount to put there, no, Mr. President? So, of the 49.7, doon lang tayo sa pieces, million. How many were donated, Mr. President? And then yung balance, I will assume we procured, no? So, yun po yung direksyon ng aking katanungan, Mr. President.
So, Mr. President, 155.8 million doses were procured, and then 95.9 million doses were donated. So,
Ilan po yung donated?
parang 2:3 halos, no?
Ilan?
3:2 pala. 95.9 million doses were donated.
Okay. So yun yung totality. But of the wasted, can we determine sa 49.7 of the wasted, how many were donated and how many were procured? Kasi yung sa donation, meron tayong excuse na 1 month, 3 months. I'm sure we did not procure such a short lifespan of vaccines, Mr. President. May minimum naman yata tayong lifespan ng ating procurement, Mr. President.
Pero donation pa. Hindi, pero donated pa. Pati si private, donated pa rin. Diba? Donated pa rin to. Private na nag-donate. So,
25 billion.
26. Oo.
Diba total is
No. I was about to say 26%. Tama?
27.37.
26,000. Oo.
27.
Yeah. Which equivalent to 27%.
Hindi, tatanong ko muna.
Sorry. So 26
Total of all
26 million was donated. And ano nga yung tapon? Hindi, wala yan dyan.
Unless meron pa rito. Tignan mo pa. Na meron
So
dito.
lahat yan ay taas.
Oo.
Siguro.
Okay.
So 27.37.
Of the 49. Of the 49. Okay. Mr. President, earlier we reported that 49.7 million is the total wastage. Of that, 26.2 million were donations. More than half, Mr. President, were donations.
Okay, so that gives us 23.7 million doses were procured
That's correct, Mr.
by the
President.
Republic of the Philippines.
That's correct, Mr. President.
And then for those of us who hate wastage, to get the value of that, I think it's safe to use 500 pesos per dose to get the ballpark figure of the total amount of the vaccines wasted, Mr. President? Will the DOH confirm around 500 is a reasonable amount to use, Mr. President? Ballpark figure lang naman. Well,
Around 1.7
500 pesos
So
per
magkano
day.
lalabas yun? So
Around mga
100M?
So parang mga
100B or
11 to 12 billion pesos, Mr. President.
23 million na po siya. So times 500. Mga
230, 2B, 10B?
1.7.
10B?
1.7.
10B,
Computing lang PS just
23, 230, 230B, 230M, 230, 2B, plus 5, 10, 11B, 11. Yeah, using that number of 500 pesos, which is an estimate, it would be about 11 billion,
It's
Mr.
11 to
President.
12 billion
Yeah,
pesos, Mr.
11 to 12 billion.
Okay, so the purpose naman ng review natin is to learn some lessons kung kung sakaling hopefully hindi na mangyari ulit ang pandemic, but there's a prediction yata or that the
We have to be prepared for the next.
and then the time period between the pandemics is getting shorter and shorter, Mr. President. So are we ordering COVID-19 or procuring COVID-19 vaccines in the 2024 budget of the DOH?
No, Mr. President. We actually have been offered COVAX donation, Mr. President, 500,000 doses.
And we will accept the donation.
Yes, we are accepting the donation, Mr. President.
And this would be the bivalent vaccines?
Yes, that's correct, Mr. President.
So at least we have a categorical answer na we are no longer appropriating any fund for the procurement of COVID-19 vaccines in the 2024 budget. In the future, Mr. President, does the DOH believe that we can avoid these NDAs, NDA provisions in the future procurement contracts for vaccines, Mr. President?
Yeah, I know, but can it be avoided? He knows that. Yeah. If it's in terms of can we refuse, we can always refuse. But, as it happened during the time of the negotiation, which the Secretary, of course, was not involved in, but this representation was familiar, not involved, but familiar because I would receive reports from Secretary of Finance, IATF, Secretary Galvez. It was demanded by the suppliers. So parang at that time na wala tayong ibang makunan or kung meron man, naalala ko noon, yung first batch ng Sinovac, di ba parang 1,000, ano lang yun, 1,000 lang. So tinanggap po yun at that time. I understand also that this was a condition imposed on many countries at umalma na rin yung ibang countries. So I don't know kung collectively pwede na nating iwasan yon na maganon tayo.
Sige. Let that be part of our review of our COVID-19 response as well as how the pharmaceutical companies behaved or made some impositions, Mr. President. Naging take it or leave it ba? Yung NDA, they will not supply us.
Both the Secretary and I confirm, that's what I've heard during that time, and that's also what the Secretary knows. Talagang, remember the production was very low still, so inuunahan natin, and they really would divert it somewhere else if those NDAs were not signed. Yeah, oo nga. My God.
Sige po,
Yeah.
siguro, but
Mr. President, if you will recall, they also required an indemnity, not just clause, but an indemnity fund, and we actually...
exemption from, ano sila?
Yeah, we actually
Yes.
passed a law. So just to put on record, so when people also studied, the measures that were taken, not just in Congress, but
Mr. President. Okay. Towards the Philippines. So, sama na natin so we can anticipate in the future. So, do we have the final or the updated figure for the number of deaths attributable to COVID-19? We have it also in the report, Mr. President.
Tama ba? 66,000 ba?
Meron. Andun, basta it's in the report. We will find it in the report. Okay. Does the report, did the DOH also study the so-called number of excess deaths? Mr. President, did we use that concept, Mr. President?
Okay. Okay. It's not in the report. Yeah. It's not in the report, Mr. President. That is something that came from PSA.
Yes, we can use the concept as a metric in our once we hold hearings on the resolution of our sponsor. It can guide us into something, or it can indicate something. So depende po, we will listen to the resource persons on the value of that figure on excess deaths during the period of the pandemic, Mr. President. So, Mr. President, one last thing, meron na naman nag-communicate po sa atin on the...
Buti pa kayo, Mr. President, hindi nagsasara ng 12 o'clock yung
Opo.
opisina
Opo.
nyo.
Bago nga po ako, bago ako magpatuloy, since our resource persons are the expert on health, is it still healthy to conduct interpellation at 12:01 after 12 hours, Mr. President? Hindi na. After spending 12 hours yesterday
The last
interpellating, so it's no longer healthy, so this will be the last question, Mr. President. The government still owes 20,000 pesos for each, the government still owes 20,000 healthcare workers, 1.94 billion pesos in back pay. Is this a correct figure? Is this a correct statement of fact? And is my figure correct? And how will we address the problem, Mr. President?
Actually, Mr. President, your figure is not correct.
Okay. How much?
What is owed is 62.7, well, the funding requirement to meet all to be able to deliver on the commitment is 62.77 billion, and this is for 10.4 million claims. These are arrears from July 2021 to July 2023.
Okay, so that's the accepted amount. We recognize it that we it is the 62.77 billion pesos. Is this only the COVID-19 allowance or special risk allowance related to the COVID-19 pandemic? 62.77 billion pesos po. Malayo pala yung report sa akin.
Yeah, Mr. President, it includes HEA, which is the Health Emergency Allowance, and the COVID-19 sickness and death compensation. Combined na po yun. Kaya ito there are 10 million claims.
Hindi, HEA is also COVID-19. Okay. So what is our strategy, Mr. President, to... our sponsor says that these are already arrears. So, ibig sabihin nun, diba, due and demandable na po ito? So, what is our strategy to comply with our obligations, and did we anticipate this or set an amount in the 2024 budget, Mr. President?
Mr. President, let me explain. In the 2024 program appropriation, we have 19.96 billion. And then there is also an amount in the unprogrammed appropriation, which is 2.35 billion. So, Mr. President, if you deduct the amount mentioned, which is the 62.77, and you deduct those two amounts, 19.96 and 2.35, that is 22.31. You are left with a funding deficiency of 40.40 billion. But, Mr. President, we have an unreleased 2020 unprogrammed appropriation of 48.96 billion, which is obviously bigger than 40. So we can cover this kung ito pong unprogrammed release. It's a very important question, Mr. President, because we have a lot of health workers waiting for this answer. Sa unprogrammed appropriation pa lang of 2023, I want to assure them that that is there. Our chairman, Senator Angara, included that there. And pagka na-release po yan ng DBM, may sobra pa pong 8.56, which siguro di naman niya i-release lahat kasi sobra nga po.
Okay.
That's the answer, Mr. President.
Okay, so it's found in the unprogrammed appropriations for the year 2023.
Yes,
Okay.
Mr. President.
So,
And then may matitira, pag nailabas yun, may matitira pa na nilagay naman natin sa 2024. So, mako-cover natin lahat.
Ano po yung nalagay sa 2024? The 2.35
Yes,
in unprogrammed?
22.31. 19.9.
Yes, programmed and
Program
unprogrammed, yes.
19.9 and 2B na hindi programmed.
So, okay, so it depends. What is the lifetime or the effectivity period for unprogrammed appropriations, Mr. President?
Kasi paano?
So, separate siya kasi. But since we have a surplus of 8.56
Talagang part siya ng budget.
Okay. Mr. President, just to be sure the answer, the response to His Honor's question is accurate, the responses are accurate. The COVID-19 sickness and death compensation was not included in the computation. But this amount is 486 million only. And as I said, there is an excess of 8.5 billion
Tama.
dun sa unprogrammed. So it will definitely be covered. We want to assure our health workers, Mr. President.
Yes, if the unprogrammed
Is released.
is released in full. Dalawa
And
po
to
yan.
be
Is
clear,
released and also,
yes.
and then depends on the amount released. But my question is a basic budgeting question. What is the lifetime or effective period for unprogrammed appropriations?
Yes. So, Mr. President, if it is released by December 31 of this year, it can be used until the end of 2024. 1 year po. So, 1 more year.
If it is released,
If it is released, unprogrammed appropriation released until December 31, 2023 can be used until the end of 2024.
if it is, but the release must happen before the end of this year.
Yes,
And then,
Mr.
And then
President.
the recipient agency is the DOH.
Yes, Mr. President.
So,
Then from the
we hope for the best. Unfortunately, Mr. President, tinanong ko yung rate of release on program for this year. It's low 30%, unfortunately. Historically, for unprogrammed appropriations, 70% ang nare-release. Historically, that's the historical. But for this year, mababa daw. So I think we need to do some following up of the, siguro with the Office of the President and the DBM to prioritize the item, Mr. President. Kasi iba, strange behavior for 2023. It's not following the historical figure of 70% released among the unprogrammed appropriations, Mr. President. Just for information from our past interpellation, Mr. President. Okay, so with that, Mr. President, so we need also some vigilance here to follow it up and some luck and also some help for the government to collect siguro extra revenues, Mr. President, in excess of projections. So thank you, Mr. President. I just wanted to greet all of you. Good morning, actually, Secretary. Good morning, Mrs. Secretary, and to the DOH family. And thank you for your patience, and of course, to thank you to our sponsor for guiding our discussion, Mr. President.
Thank you very much, Minority Floor Leader, for your very enlightening questions to give clarity to all our listeners and viewers and your late-night callers, Mr. President.
Thank you, Mr. President. Mr. President, next to interpellate, just a short interpellation. would be our Deputy Majority Leader, Senator J.V. Ejercito. I move that he be recognized, Mr. President.
Our Deputy Majority Floor Leader, J.V. Harris, is recognized.
Yes, thank you, Mr. President. I'd just like to ask our chair a few questions. I'm sure that this will also interest our Senate President because I think all of us made interventions last year to add budget, especially for the specialty centers, which is also a priority of the President. For the record, Mr. President, Madam Sponsor, maybe spread to the record how much is our budget allocation for the establishment and improvement of specialty center under this year's General Operations Act.
Mr. President, 10.23 billion.
Yes, if I can recall, Your Honor, Mr. President, last year, the original budget was about 4.5 billion. Then the Senate initiative through the Senate President added 2.2 billion and a lot more. So that's about 10 billion. But as of today, I just like to know how much has been utilized by the DOH from the utilization. How much has been disbursed so far?
So how much has been, wait, sorry, is this year? As of today. So as of today, Mr. President, of the 2.235 billion, the obligation rate is 59.17% and the disbursement is 18.54. Tataas pa ba ito or what? Construction?
I'd just like to add, Mr. President, for 2023, no? Because the real budget was 4.5, then we added 2.2 billion. I'd just like to be clarified, Your Honor, if is it true that the utilization rate is only 0.9% as of the moment, Your Honor? Specialty center.
Yung pinakabago po doon is 59%, Mr. President.
59%, Your Honor? Out of the 6.7, yung pong dinagdagan natin. We just want to make sure that, kasi because we added a lot, no? Considering that this is one of the priority programs of the administration and the PET, another PET program of our Senate President.
Mr. President, I just want to reconcile his Honor's figures and our figures. What figure can you repeat your figures?
For 2023, Your Honor.
Are you talking about 2.24, Mr. President? 2.24 billion?
The total of 6.7
Kakaiba kayo.
under the DOH HFEP, Your Honor. The original budget was 4.5.
So you're including, sorry, Mr. President, I need to reconcile these figures.
This is the 2.2, which is an appeal, and then
6.7 total kasi dinagdag natin ng 2, di ba? Yeah, the original budget last year was 4.5, then through the Senate initiative we added 2.2. So it's yung 6.7 billion that was intended for the specialty centers.
Yung HFEP? Sige, a minute suspension, Mr. President.
Session suspended.
Kaya magkaiba. Yeah, kasi HFEP is not just specialty centers. Iba-iba yun.
Hindi, pinapataas lang nila. Kasi 59, hindi abot ng 59.
Kaiba, JP. Show them. Show them. Parang wala silang disaggregated. Ready to resume?
Session resumed.
Thank you, Mr. President. Mr. President, I'll repeat the figures I mentioned. The obligation rate of 59.17% and the disbursement rate of 18.54 is for the figure of 2.235 billion, which is the amount that His Honor is referring to that was added by the Senate, Mr. President.
So with that amount, actually we still have another month. I'd just like to ask also the DOH what's their catch-up plan so that we can maximize, because for 2024 the budget for specialty centers will be increased to about 10 billion. So just want to make sure that it will be
Correct.
maximized and utilized. Your
Of
Honor.
course. So, Mr. President, I'm told that by December 2023, 84% will be obligated. And then by January 2024, 100% will be obligated. And therefore, they are confident that the increased funding that will be provided in the 2024 GAA would be utilized to the maximum, Mr. President.
Anyway, Your Honor, Mr. President, last year, the DOH identified hospitals about 10, and this 2024, we increased already. Am I correct? That we increased already the identified specialty hospitals?
9, 28 plus 9, at total is 45. This is all happening for 2024 only. Okay. So for 2024, Mr. President, His Honor is correct. It is 45 specialty
45.
centers. Yes, and the total cost would be 10.2 billion, Mr. President.
I'm looking at the expenses that we have, no, the infra, also the equipment. And Your Honor, Mr. President, I was able to go around also. I had the chance to visit some of these hospitals, and like the Western Visayas Medical Center, PJ Garcia, some are already, the infrastructure are already almost complete. I just like to probably, if we can, I propose that if we can concentrate on the equipment, no, because I have seen most of this. Some of these hospitals that are ready already, and I would like to send send to the Secretary and the DOH which hospitals are almost complete the infrastructure, because I get the chance to go around the country riding my bike, and I also get to visit these hospitals, and some of them yung equipment na lang pong nire-request nila, if it's possible, if we can prioritize. PJ Garcia, Western Visayas Medical Center, yung Southern Isabela Medical Center, and others, and Northern Mindanao Medical Centers. Ang ano na po nila, Madam Chair, so that we can already maximize and use they can be used already as soon as possible. If we can prioritize in equipping all of these identified hospitals whose infrastructures are already
Yes.
ready.
Yes,
Your
Mr.
Honor.
President, I was discussing with them while listening to you, to His Honor, and definitely yung for equipping na lang, no, meaning to say the infra is already there, they just need equipment. There are 9 specialty centers, and then after that, yung for upgrading is 28, and then yung new construction is 9. So there is a prioritization, Mr. President. Thank you.
For 2024, Your Honor, Madam President, Mr. President, Madam Chair, I have a list also here that for infrastructure, it's about 8 billion, 8.2 billion. For infra, it's about 8.2 billion. For equipment, it's almost 2 billion, no? Or 1.9 billion, or a total of 10.2 billion.
Yes, that's correct, Mr. President.
So we're hoping that if we can also prioritize now, this time, kasi po yung infra parang medyo, I think it takes a while. But for some of those that are already ready, they're just waiting for equipment, probably if we can request the DOH so that it can be used right away, you know. And we're hoping that at the soonest possible time, with this budget, at least we can have a more complete specialty center that can be used already in about 2 or 3 years, Your Honor.
Yes, Mr. President.
There are also requests, I'll just forward, Your Honor, Mr. President, Your Honor, to DOH. For example, yung po, nabanggit ko kanina because I was able to visit some of them, like I discussed with the Secretary. Some of the hospitals that we funded together, no? Yung, PJ Garcia, Western Visayas, those I mentioned, sayang po kasi it's already, the infrastructure is already there. Yun po, I hope that we can already prioritize putting the equipment. And also some of the provincial hospitals that are also ready and that are really supporting the the program, no? And it's worth helping some of these facilities, Your Honor.
Noted, Mr. President, by the Secretary.
And last but not the least, Your Honor, with regards to the UHC Act, it mandates DepEd and DOH to set standards designating schools as healthy settings and address public health problems through the school system. At present, data shows an average of 1:8,114 nurse to student population ratio nationwide, which short of the DepEd proposed ratio of 1:5,000. School health and nutrition is also currently part of shared services among schools within a division. In the interim, schools were directed to designate teachers who will act as clinic teachers. However, Mr. President, our teachers have a lot on their plate, and this program will be an additional task to them. So we just like to know if the DOH has an ongoing or a new program to address public health problems through the school systems. The reason I asked Madam Sponsor, Mr. President, because this is also part of the UH here.
Yeah. So, Mr. President, well, even in the earlier discussion with the minority floor leader, we pointed out that that is the challenge to really be able to audit what our needs are when it comes to human health resources. And I think we took this up during the deliberation of the bill. And an immediate solution is the clinical care associate, which would be most likely nursing graduates who then can receive special training on the specific needs. So in this case, for the schools, the school-age children, and they would be able to provide the services necessary with the guidance, no, of other experienced nurses and doctors who would be handling a bigger number, no, basically supervising these clinical care associates, Mr. President.
Well, thank you, Madam Spor, Mr. President. I'd just like to bring this up so that at least it's nice so that at least the DOH would already prioritize and make sure that as part of UHE that this will be given attention, Your Honor. So,
Yes,
Mr. President,
Mr. President, thank you.
Thank you, Mr. President.
Thank you. Maybe the gentleman from San Juan can be the majority floor leader for the meantime and recognize Senator Bongo.
Yes, Mr. President. Next to interpolate is Senator Bongo. I move that he be recognized.
Our distinguished colleague from Davao and the Vice Chair of the committee as well as Chairman of the Committee on Health. Yan, nagkakasakit na ako. Excuse me. I'm also getting colds, I think, from staying late at night, every night. So, I hope it's a short
Thank you, hardworking Mr. President. Ayaw kong magkasakit ka para makagising ka pa bukas. Huwag kang mag-alala, maraming doktor dito. Maraming gagamot sa inyo. Andito ang ating dancing doctor. Meron na rin tayong mga sleeping doctors. As chairperson of the Committee on Health and Demography, I want to underscore the importance of the 2024 budget of the Department of Health in our path towards recovery. As I have said many times before, now is the time to invest more in improving our healthcare system. We must make sure that our health budget is responsive to the needs of our healthcare system. On that note, Mr. President, will the good sponsor of the DOH yield the floor for a very few questions lang po? At yung iba ako nang sasagot sa tanong ko.
Yung the best part po doon, yung second part nung sinabi nyo, of course, we will be happy to try to answer the questions of His Honor, the Chairperson of the Committee on Health.
Thank you. May we know how much additional budget is DOH requesting and how much were we able to add in our committee report? Which programs and budget appeals were prioritized, Mr. President?
Well, Mr. President, the Senate increased by almost 50 billion the amount indicated in the NEP from 306.13 billion to 353 billion. The wish list, of course, of the agency and, well, DOH and its attached agencies and corporations is much bigger. But these are the amount, 50 billion was what was accommodated in the Senate committee report, Mr. President.
Thank you, good sponsor. I support the increases in the health budget. In fact, I also wrote our finance chairman, Senator Angara, to push for additional budget for the DOH. During the budget hearing, I mentioned the importance of the continuous upgrading of our health facilities. Mahalaga po na patuloy nating upgrade ang ating mga pampublikong ospital na karamihan naman ay mahirap po ang pumupunta at nakikinabang dito. Sa dami po ng pumupunta sa pampublikong ospital, hindi na po nagkakasya mga pasyente. Last Congress, we passed 69 laws for the improvement and establishment of various public hospitals all over the country. Importante po na mabigyan ng sapat na pondo ang mga batas na ipinasa natin para sa pag-upgrade o pagtatayo ng mga pampublikong hospital. We must ensure enough funding for the Health Facilities Enhancement Program, lalo na marami pang pasilidad ang kailangan po ng upgrade. Super health centers, I have been advocating for the construction of super health centers all over the country to make primary care services more accessible. Super health centers are designed to focus on primary care, consultation, and early detection. I note that the construction of 117 super health centers is included in the proposed budget for next year. At ang konsulta package po ng PhilHealth can be accessed in super health centers once they are completed. Paano ang magiging proseso at partnership ng LGU? Libre ba ang konsultasyon? I have noticed po sa increase, andito po ang ating presidente ng CEO ng ating PhilHealth. Meron pong increase, no? 101 billion na po ang budget ng PhilHealth. 21 billion shall be used for the benefit packages improvement and comprehensive outpatient benefit package. Ito po yung konsulta. Magko-complement ho ba itong mga super health center sa ating konsulta package?
Yes, Mr. President.
Itong additional budget ay gagamitin po sa konsulta package na
Yes,
pwedeng
Mr.
gawin
President.
dito.
Yes.
Mr. President, once super health centers are completed, they can serve as consulta accredited facilities. We hope the DOH and PhilHealth would collaborate closely on this for the successful implementation of these projects and programs. Regional specialty centers, earlier this year, we passed the Regional Specialty Centers Act. Promise po ito ng ating Mr. President, no? Ang ating reading, Mr. President. Mr. President, promise mo po ito. Wala na. Mr. President, di ba ito yung campaign promise mo na tinupad po natin?
Regional.
Oh.
Yes. Am I the one being interpolated? Yes,
Yes.
please. Yes. That is my principal, my baby and our advocacy in the last Congress.
Yes.
And naipasan natin yun. So hopefully ma-implement na po.
Correct.
Nice.
We passed the Regional Specialty Centers Act. 10 billion is already included in the committee report for the implementation of this law. This is a multi-year program at sana po mabigyan ng sapat na pondo para hindi na kailangan pumunta po ng Maynila ang mga pasyenteng may malubhang sakit sa mga probinsya. Ilalagay na po ito sa mga existing DOH regional hospitals, itong 17 specialty centers. I also want to know how many human resources, another topic na po ito, no? For health and HR deployed in local government units, meron ho ba tayong enough funding for the HRH next year?
Yes, Mr. President.
Yan, may for deployment po tayo and for scholarship.
Anong tanong? Sabi niyo may enough. Ang sagot ko po,
may enough
yes.
funding pa po. Kasi daming tuloy-tuloy po yung mga request ng LGUs dito.
We included 16.9 billion, Mr. President, for this.
Some LGUs still need support of the national government. Yung iba po ay hindi kayang mag-hire ng personnel, lalo na po sa mga malalayong lugar. Madam Sponsor, ito naman pong renationalization. What is the position of the DOH regarding renationalization of some hospitals? Dahil as chairman po ng Committee on Health, ako po ang mag-sponsor nito dito after magagaling po sa lower house. I understand that considering health is devolved, LGUs are expected to support their own hospitals. Paano po yung mga LGUs na kulang rin po ang pondo at hindi kayang tustusan ang hospital sa kanila? Yung ibang hospital po, hindi lang isang probinsya ang catchment population. Marami pong pumasa sa lower house at pagdating dito sa Senado, hindi na po pumasa dahil nga po doon sa implementation. Yun ang naging rason, no? Yung implementation ng Mandanas ruling.
Mr. President, the question is, what is the position of the Department of Health?
Yes. Priority ho ba ang renationalization?
Well, Mr. President, the goal of the department, according to the secretary, is to have a tertiary hospital or a DOH-run level 3 hospital in every province. So what they are doing what they are prepared to do with respect to a renationalization policy is to assess what are those priority areas. So if wherever there is a low capacity of a hospital, meaning to say yung hospital either it's not managed well or whatever, low capacity, yung ability nila to meet the needs of the population is very low. So low capacity and low din ang income dun sa lugar na yon, yung probinsya na yon. And then nandun nga ho yung gap in terms of yung the services that are needed is very high, then those would be the priority areas for renationalization. Ngayon, kung i-request lang ho ng, let's say, isang probinsya, whether it's a governor, congressman, whatever, in an area, na i-renationalize yung ospital na meron namang functioning hospital doon na maganda, then hindi ho priority yon. So
Salamat,
it would really depend on the needs, Mr. President. Need basis.
Salamat, Mr. President. Going to Malasakit Center, aside from accessibility of health facilities, equally important is the affordability of health services. That is why I principally authored and sponsored Republic Act 11463 or the Malasakit Centers Act, which mandates the establishment of Malasakit Centers in all DOH hospitals and the PGH. Per last report, 7 million na po ang mga pasyenteng natulungan ng Malasakit Centers. Do we have updated figures na po sa ngayon, no? As of today, ng mga natulungan po ng Malasakit Centers?
Kailan ho ba yung latest update na natanggap ng ating kasamahan?
Nabasa ko yun during the time of former OIC.
Okay. Mr. President, as of October 2023.
So marami na pong mga mahirap nating kababayan ang natulungan Malasakit Centers at umaasa sa tulong ng gobyerno kapag sila po'y na-hospital. Malasakit Centers ensure easier access of patients to government assistance. We must strengthen the operations of Malasakit Centers. Dapat walang matanggihan na pasyente considering the budget we are allocating for the medical assistance to indigent patients program. I notice po na malaki ang budget ng MAIP. Ang pakiusap ko lang po, gamitin ito para sa mga indigent patients. Ito sa mga poor and indigent patients, yung mga walang matakbuhan, yung mga helpless at hopeless nating mga kababayan na walang inaasahan po ng tulong po mula sa gobyerno. Huwag po natin silang pahirapan, pera naman po ito ng taong bayan, ibalik po sa kanila. During the Commission on Appointments hearing of Secretary Herbosa, he committed na walang matatanggihan na pasyente na nangangailangan ng tulong. The Secretary also issued a department memorandum stating that all patients must be accorded with available services that they need in Malasakit Centers. Again, I would like to remind the good Secretary na dapat po ay walang pipiliin at hindi po selective ang pagbibigay po ng tulong. Hindi dapat magamit sa politika ang pagbibigay ng tulong dahil ang Malasakit Center po ay ginawa para sa mga poor and indigent patients. Lahat po na nakapila ay dapat tulungan. Moving on, Mr. President, hindi rin po natin dapat kalimutan ang sapat na pondo para sa mental health program, lalo na sa panahon ngayon na maraming krisis na kinakaharap ang ating mga kababayan. Marami pong nag-commit ng suicide during that time of the pandemic, no? Magkano po ang PhilHealth coverage for mental health cases? Do they have outpatient coverage? What is the plan of PhilHealth for the benefit packages for mental health cases and consultation? Napaka-importante po nitong mental health problem or issues natin.
Yeah, the answer is of course, merong outpatient. Diba? That's all considered outpatient? 4.7? No. Sama-sama na. So inpatient and outpatient. Oh. Yes, Mr. President, this question was also asked by His Honor, our Minority Floor Leader, and we confirm that there is a budget for mental health. It is 4.77 billion, and this includes both inpatient and outpatient services and commodities, Mr. President.
In 2023, 1.9 billion is included in the budget for the mental health program of the DOH. In the 2024 NEP, the proposed budget is 683 million. Ay dapat pong pagtuunan po natin itong mental health programs. We should continue to improve our mental health programs and ensure that all forms of psychosocial assistance will be made available to Filipinos who are suffering from all forms of mental health issues, especially at this time of crisis. Sana po ay madagdagan ang budget para sa mental health. At lastly po, last Congress, we passed Republic Act 11712, or the Public Health Emergency Benefits and Allowances for the healthcare workers, sponsored by the Finance Chair, Senator Angara. Ayon sa DBM, meron naman pong na-release na 23.6 billion na pondo po mula sa budget ng gobyerno ngayong taon, 19.6 po sa program appropriations at 4 billion from unprogrammed funds. At sana po meron pang inaasahan ang ating mga healthcare workers. Wag po sana nating silang pabayaan. May nabasa po ako na plano nilang mag-rally, no? Kasi ito po ay services rendered already. According to the data na nakuha ko po, nabanggit na rin po kanina, 62 billion po mahigit ang arrears, no? Since 2021 na dapat na bayaran po sa ating mga healthcare workers. Services rendered na po ito. Ibig sabihin, pinaghirapan na po ito at pinagpawisan. At nakikiusap po ako sa ating Department of Health and DBM. Obligasyon po ito ng gobyerno. Pinapaalalahanan ko lang po kayo. Kayo po ang implementing arm ng gobyerno, ang DOH at DBM, na ibigay po what is due to our healthcare workers. Maliit lang po ito na halaga kumpara po sa kanilang sakripisyo sa panahon ng pandemya. Hindi po natin mararating ito kung di po dahil sa kanila. Ang iba po ay nagbuwis ng buhay, ang iba po ay nagkasakit sa panahon ng pandemya. That is all, Mr. President. I have no further questions. Sinagot ko na rin po ang aking tanong. Nagpapasalamat po ako sa good sponsor who is a fellow health advocate for advocating for the health budget and for taking the time to answer my few questions. I continue to push for additional budget for health. Napaka-importante po. The more we should invest sa ating healthcare system. Salamat po, Mr. President.
Thank you, Mr. President. Just to put on record, yung mga last 3 or 4 topics ng ating kasamahan, hindi na yun question, statement po. But because napakahalaga, baka may nakikinig ho sa inyong health worker, nasagot po natin yan. We have allocated funding from in the 2023 budget. Pag na-release po yung unprogrammed, sobra-sobra pa po yung pondo. Tapos meron pa tayong 2.something billion for 2024. Covered po ang lahat ng arrears natin sa ating mga health workers.
Salamat. I will continue to remind and to appeal sa ating DBM na ma-release po itong mga unprogrammed funds, no, na may bigay kaagad. Narinig ko po na meron na pong mga nabayaran, no, sa mga LGUs, sa mga hospitals ng 2021 sa DOH, 2022 at 2023. Sana po ay mabalikan kaagad sila dahil sabi ko nga, pinaghirapan nila ito, pinagpawisan po ito ng ating mga healthcare workers. Patuloy po akong magre-remind at magpapaalala bilang chairman po ng Committee on Health.
Thank you, Mr. President. And just for the record, so accurate po ang sagot natin, may the record reflect that the National Health Workforce Support System budget is 17.98 billion, not what I earlier reported na 16.94 billion, because the 17.98 billion includes deployment and scholarship. Please, let's make sure that our record reflects the correct amount, Mr. President. Thank you very much to our colleague, the chairman of the Committee on Health.
Thank you very much. Madam Sponsor,
Yes, Mr. President,
if
thank
I may,
you.
Majority Leader, I'll just ask, I also want to ask, just a clarification. I had a message from the Secretary, he was in Bukidnon 2 days ago, 3 days ago, for the caravan of Speaker Martin. Yeah, he had a big caravan there. And I remember he mentioned to me that he needs an additional budget of MOE for the building that we donated. I don't know if you remember, during the time of President Duterte, we actually inaugurated that building from our friends of the Philippines Foundation from Hong Kong, Kitson Ko, and he donated the Northern Bukidnon Health Wellness Northern Mindanao Wellness Center. It's a very, very good facility. They spent about 500 million pesos, privately funded, not a centavo paid by government. And I think there is kulang na MOE. Maybe we just ask the good sponsor if he can ask the secretary. I wasn't able to ask earlier. I should have asked earlier. But what is the need for the 18 million for?
18 million for the MOE for that center, Mr. President. Additional 18 million is needed.
What is the capacity now, and what would the 18 million be able to achieve if we add the funds?
For additional capacity, Mr. President.
Right now, how many people, what is it being used for right now, Madam Chair? I have not followed that up
It's a
yet.
drug rehab, Mr. President.
So it's being utilized as a drug
Yeah,
rehab.
so there are currently 50 residents, and it can be doubled with the additional MOE.
Okay. Yes, because that's a huge facility. That's a very large facility. Maybe we can also ask the Secretary. Secretary, what we were trying to envision for that facility was not only for drug rehabilitation, but also for mental mental health issues. Because we have a problem with mental health issues in the province. Wala po tayong mental health care facility.
It's actually, what the plan is, Mr. President, to include community mental health as part of the services offered by that center.
If I can get the promise from the Secretary that if we do add that 18 million, can we please start already accepting mental health patients, Mr. Secretary? Because the private institution there is too expensive. It's called Happy Home.
Oh, Mr. President, the plan is outpatient, so they can treat but outpatient.
Okay.
Hindi ho kayo happy doon, Mr. President?
Well, sayang yung facility. You know, sayang talaga. If you visited that facility, it's huge. It's a huge compound, several buildings.
Mr. President,
Opo.
the Secretary
Dormitories
is
as
simply
well.
explaining that you need a separate facility. You cannot really combine the two different types of patients with those different health issues, Mr. President. So baka pag dinagdagan natin, they can put a fence or a wall.
Actually, the whole facility is walled, but maybe
No,
in
the
between.
two.
In between.
Something like that.
Yes.
So can you come up with something in 24 hours so we can make the appropriate amendments? I mean, what's that additional budget? We would have to know.
That would be a capital outlay, siguro, Madam Sponsor,
Okay.
and an MOE.
Yeah. Mr. President, ano ba?
Anyway, we
Sa
can work
ngayon-
it
sa
out for
ngayon-
next year.
Yeah. Sa ngayon, ang gusto nila, they'd like to somehow perfect the services offered for the drug rehab.
Okay.
But they are very willing and ready to offer the community-based outpatient mental health services. And then maybe by next year they'll be prepared for, they can start studying about the need and their ability to service inpatients for mental health.
Although I must say that was utilized very, very well during the pandemic. It was, I believe, that's where they were housing most of the positive patients, I think, at the time, who were isolated. So they utilized it at that. So yeah, thank you, Madam Sponsor, for answering that. Mr. Secretary, thank you. We'll try to find that 18 million for you. Thank you.
Thank you.
Mr. President, before I make the motion, Mr. President, I was, being the majority leader, parang pambansang utusan tayo dito, Mr. President. The Senate President Pro Temp.
Mr. President,
Ask
I've already brought that up.
Okay.
Yung drugs that are needed for COVID treatment.
Remdesivir.
We've taken it up, Mr.
Yes,
President.
Mr. President.
I also have
Thank you.
taken seriously yung binilin sa inyo ng ating Senate President Pro Temp.
Thank you very much, Mr.
That's
President. At least wala nang maninita sa akin tomorrow. Mr. President, there being no other reservation for interpellation, I move that we close the period of interpellation and debates and consider the budget of the Department of Health, Office of the Secretary, National Nutrition Council, Philippine National AIDS Council, budgetary support to government corporations, Department of Health, Lung Center of the Philippines, National Kidney and Transplant Institute, Philippine Children's Medical Center, Philippine Health Insurance Corporation, Philippine Heart Center, and Philippine Institute of Traditional and Alternative Healthcare be deemed submitted for the body's consideration. I so move, Mr. President.
And I'd just like to put on record, I believe this is the first budget of Secretary Ted Herbosa. As Secretary, it's your first budget.
The only secretary appointed 3 times, Mr. President.
Oh, that's
Well,
right.
this is not
The
yet
Department
his
of Health.
hand-woven budget because dinatnan na rin niya to, so konti pa lang yung intervention niya. Next year daw niyo abangan.
Much
But
better.
that's the reason
good.
why I mentioned it, Mr. President,
Good news.
because you can feel that the trust of the President is there and trust of the even the lawmakers, Mr. President. So we congratulate the Secretary.
And we're hoping that Senator Bongo can already arrange the date for his appointment. Nandito yung kanyang chairperson sa Commission on Appointments. Ano ba yung date? Libre ako next week. Hindi pa pwede.
I don't get pressured by any secretary.
Oo nga po, we had no time at that time.
Move for the previous question, Mr.
Okay.
President.
Well, I just wanted to find out from Senator Bongo when the date is. When is it? Inayos nyo na? Oh, sige.
Tomorrow
So
daw,
therefore,
tomorrow.
there being no objection to the... Huh? You want tomorrow? May 3-day notice so next week na. There being no objection to the motion of the majority floor leader, the budget of the Department of Health and all its attached agencies are hereby deemed submitted. Congratulations. Session suspended.